Hello, my name is Jennifer Rickerby, and I am a Doctor of Nursing Practice student at George Mason University. I'm welcoming you back to Cultural Competency in the School Setting. This is Module 3 in the Cultural Competency Education and Learning series. And now we are going to just quickly review the icon key. The head with the cogwheel is critical thinking activities. The movie screen is for watching videos. The hammer is asking you to take actions to complete. And the eye is for further information. Here is an overview of the modules and training. Where we are right now is at Module 3, which is a little bit more than halfway there. Cultural competence in the school health setting. We're going to compare World Health Organization global school health goals to what the CDC is suggesting for school health goals. We're going to evaluate social determinants of health in daily school nursing practice, analyze the National Association for School Nurses 21st Century Model for School Nurses as a culturally competent school health model. We're going to summarize the 12 Purnell cultural domains for cultural competence, and we're going to be prepared to work to break down those silos of social determinants that are still in existence and plan methods to build bridges to culturally appropriate care for our patients. This is a graph provided by the National Center for Education Statistics, and it's showing the percentage of distribution of children that are enrolled in public schools. So this is a spread across 2003, 2013, and then it's giving a sneak peek of what we're going to look like in the year 2025. And as you can see, for the white population in 2003, we're at 59, and now we're moving down in that percentage to 46%. But you're seeing a large rise in the Hispanic populations, and you're also seeing a doubling in the 2 or more races category, meaning that there's more and more multiculturalism that's out there. So Standard 8 from the American Nurses Association is written in congruency with our standard of nursing practices. And what the American Nurses Association is saying that in order to achieve cultural competence, you need to have a little bit of all of these competencies met. So demonstrates respect, equity, and empathy in actions and interactions with all healthcare consumers. Also participates in lifelong learning. And this is in relation to changing the cultural worldview that you may hold and making decision-making in terms of the diverse consumer. Creates an inventory of one's own values, beliefs, and cultural heritage in order to be culturally competent. Applies knowledge of variations in health beliefs, practices, and communication patterns in all nursing practice. Identifies the stage of the consumer's acculturalization and accompanying patterns of needs and engagement. Considers the effects and impacts of discrimination, oppression on practice, and how that can affect vulnerable cultural groups. Uses skills and tools that are appropriately vetted for that specific culture, literacy, and language of the population served, as well as the individual. Communicates with appropriate language and behaviors, including the use of medical interpreters and translators in accordance with consumer preferences. Advocates for policies to promote health and to prevent harm among culturally diverse, underserved, underrepresented consumers. Promotes equal access to services, tests, interventions, health promotion programs, and other opportunities, and educates nurses, your colleagues, and other professionals about cultural similarities and differences of healthcare consumers, families, groups, and communities. When I look at Standard 8 in the American Nurses Association Standards of Practice, this really represents to me the role of a school nurse and all the things that a school nurse is required to do. The Raise to Action acronym is a way to raise the bar, so to speak. When you're looking at that scope of practice, it needs to be integrated into your daily practice, developing culturally congruent care in every situation and setting. And sharing the word and encouraging other nurses to integrate that scope of practice also. And excelling in using knowledge and conducting and applying research to achieve the highest quality evidence-based care. This illustration is a graph showing the demographics of nurses that are represented in the United States according to race. As you can see at the bottom of the picture, white nurses are at 75.4%, where the race and culture for Hispanic nurses are only 7.5%. 5% of all nurses. And considering how much our population is changing, having a larger Hispanic population, this workforce is not representing the diverse community that needs to be served. So some things to take into consideration are that where a person was raised and where they live now may have different effects on their perspective. So school nurses may live and work in two different demographics. It's absolutely vital, specifically for school nurses and other community health servants, to learn the demographic in which you are serving. Learn where your students are coming from. A good place to look for this information is dashboards for your area, and really review those dashboards on a regular basis, looking at the updates and changes that are happening to your community in terms of demographics to make sure that you're upholding the class standards and the ANA standards of practice. So the World Health Organization has goals for 2020 to increase the number of health-promoting schools worldwide. So what they're looking for, and what the definition of this essentially is that a school that is health-promoting school fosters healing and learning. They engage health and education stakeholders. They promote healthy environments. They implement policies and practices that respect an individual's well-being and dignity, including cultural diversity. They strive to improve the health of all associated with the school. This includes personnel, students, families, and the community. So this focus on healthcare promotion is caring for not only others but for oneself, so making sure that we are healthy as well as other people. They were making healthy decisions and taking control over life circumstances, creating conditions that are conducive to health. We're building the capacity for peace, shelter, education, food, income, a stable ecosystem, equity, social justice, and sustainable development of our community. Preventing leading cause of death, so looking at issues that could become problematic and could affect our population. And some of these are tobacco use, HIV, sedentary lifestyle, drugs, violence, alcohol. All of these things are addressed through school health. We want to influence health-related behavior, so showing knowledge, beliefs, skills, and attitudes that support health-related behaviors. What follows along with that is the CDC's whole school, whole child, whole community model, which is showing you at the middle there, you've got the child that's surrounded by a healthy, safe, engaged, supported, and challenged environment, that there are coordinating policies, processes, and practices that improve the learning and improvement of health in general of the child. And then what you can see encircled around that are all the different elements that are impacting that child and impacting that community and that school. And that's physical education, nutrition, environmental services, health services, counseling, psychology, social and emotional climates, physical environments, employee health, family engagement, community involvement. So all of these things are part of the community, and what this model has specifically done well at is putting school as part of the community, which is one thing that is not always inclusive. Schools are part of the community, and they have a direct effect on our students, and it's very important that we look at it that way and consider culture in all of these elements. So social determinants of health, so 80% of social determinants directly cause 80% of health concerns. So when patients have social determinants and they're unable to have access to care, this can increase our health concerns by 80%. And 25% of children attending school come from homes that fall below the federal poverty level. 25% is a very high percentage. So this includes barriers such as income, housing, transportation, employment, access to health insurance, education barriers, health literacy, behavioral factors, and inappropriate services. So think of a time in your practice when you addressed the social determinants of health. What steps did you take to break through those social determinants? And I think that school nurses can speak to this very well. They're often identifying students that are lacking clothing, food, that are unable to get where they need to go for health care, and parents that have to work and are unable to address needs of their kids. It's a very difficult area, but how did you in your practice break through those social determinants? What did you do to go that extra mile? And so the school nurse works with the students and families in their neighborhoods and homes, addressing social determinants such as access to care, safe and healthy environments every day. And I think that that's a really strong statement that school nurses address disparities in health every day in practice. Connie is a middle school nurse, and she's noticed a major barrier to appropriate mental health care for students. So what she's identified is in her community there's not enough mental health services, and the ones that are available are not really accessible to everybody. Connie works one-on-one with families to connect parents and guardians with healthcare providers, coordinates care at school, and monitors student follow-up appointments. Once the appropriate connections are made and the student begins following a treatment plan, students show improvement in school and social functioning in a short period of time. So this is really demonstrating that by following these patients, making sure that they're getting the care that they need, this specific nurse is seeing that there is a big improvement in such things as being in school and being present more often. So the cog wheels here and in the head say, assess for social determinants, identify a need, discuss the need with the family, research resources, collaborate, and connect. The National Association of School Nurses position statement states that the vital role of the 21st century school nurse is as follows. School nurses have 55.9 million students in public schools, so you have access to a great amount of young lives. It's a pivotal role in identifying, managing, and monitoring health conditions in school-aged children. There are 5 elements to the 21st century model, and they are as follows. All school nurses must incorporate clinical standards, leadership, community and public health, quality improvement, and care coordination. So it's the National Association for School Nurses are agreeing with the CDC and the World Health Organization and taking a unified stance on what school nursing practice looks like. So this framework that has been developed is going through all of those elements. So we have the standards of practice here. What is care coordination? What is leadership? What is quality improvement? And what incorporates the community? And this model flows very nicely with the student at the center, care coordination, leadership, quality improvement, and community and public health. But we are always surrounded as nurses by our standards of practice that can never be let down. The National Association of School Nurses defines culture as more than just a different race or ethnicity. It may also include the following: where a person was raised, occupation, life experiences, religion, sexual orientation, language, social order, and dietary practices. So this model here was developed by Purnell. It's 12 cultural domains for school nurses. So it's specific for the school nurse, and it says that none of these domains should stand alone. When you're looking at a patient, you're assessing them, you're deciding on a plan of action, all of these things need to be incorporated, and it looks like a very complicated wheel, but it really has to do with some really basic 12 domains that involve the heritage overview, communication, family roles, workforce issues, bicultural ecology, health risk behaviors, nutrition, pregnancy and childbirth, death rituals, spirituality, healthcare practices, and the healthcare practitioner. So how can the school nurse achieve and maintain cultural competence? By recognizing your own identity, respect differences, be culturally responsive, and social justice, engage in lifelong learning, and cultural competence, like many other nursing skills, needs to be constantly revisited to keep that skill sharp, up to date, and changing with your demographic and population. Breaking down those silos involves healthcare systems, education, housing, public health work. Not only are funded in silos, but trained and they work in silos. So nurses, they work to bring these services together. They bring together the service of healthcare with education, with housing, with public and community health. Bring all those things together and work towards the betterment of the student. They bridge gaps. They build a culture of health to enhance the learning health habits of students and families. They coordinate and collaborate. School nurses often bridge gaps by being very equitable to all students, identifying needs, and then making a connection and bringing it to the forefront and saying this child has a health need. School nurses also provide a gateway for improved access to care. So such things as school-based and linked clinics and other providers in the community, forming those bridges or assisting students to be seen and receive health care. So social determinants and cultural competence. So once again, the National Association of School Nurses is discussing how the school nurse addresses social determinants. So this nurse went out of her way to bridge patients and families to mental health care needs, but how can she specifically make sure that they're continuing to use those services? So the one way that she can do that is through evaluation of the bridge. So this nurse can evaluate that bridge and make sure that it's culturally appropriate. And so that's about checking back with the family, making sure that they did go to the service. Are they going to continue to go to the service? What is the problem with the service if they're not? And why is the bridge a good bridge? I think that that's really something that is important, because if people do not feel comfortable in a particular service, they're not going to continue to go to it, or if it was difficult to use. So I think that not only do we need to make bridges, but make sure that those bridges last, or we make the right or the appropriate bridge. So these are my references. Thank you for listening.